When assisting a resident with left-sided weakness from a stroke, the CNA should place the cane A. in the resident's left hand, B. in the resident's right hand, C. on the wheelchair, D. on the left foot. Answer, B. The cane should be placed in the stronger, unaffected hand, which is the right hand in this case. Which of the following best helps prevent the spread of infection? A. Wearing gloves at all times. B. Using alcohol wipes on doorknobs. C. Washing hands before and after care. D. Avoiding sick residents. Answer, C. Hand washing is the single most effective way to prevent the spread of infection. When a resident is unconscious, oral care should be provided. A. Only once per day. B. With the resident in a flat position. C. Using lemon glycerin swabs only. D. With the resident positioned on their side. Answer, D. Positioning the resident on their side prevents aspiration during oral care. Which of the following is a sign of dehydration? A. Moist skin. B. Increased urination. C. Dry mouth and cracked lips. D. Low pulse. Answer, C. Dry mouth, cracked lips, and sunken eyes are common signs of dehydration. When should a CNA document care provided to a resident? A. At the end of the shift. B. Before the care is given. C. Immediately after providing care. D. During lunch. Answer, C. Documentation should be done immediately after care to ensure accuracy. A resident's bed is in a high position after care. What should the CNA do? A. Leave it for the nurse. B. Lower the bed to the lowest level. C. Raise the side rails. D. Pull the curtain open. Answer, B. The bed should always be in the lowest position when not in use to prevent falls. The term aspiration means A. Swallowing normally. B. Inhaling fluid or food into the lungs. C. Rapid heartbeat. D. Repeated coughing. Answer, B. Aspiration occurs when food, saliva, or liquids enter the airway or lungs. If a resident begins to fall while ambulating, the CNA should A. Catch them by the arms. B. Hold them up forcefully. C. Ease the resident to the floor. D. Run to get help. Answer, C. Assist the resident to the floor safely to avoid injury to both the resident and the CNA. What is the best way to identify a resident before giving care? A. Ask their roommate. B. Check the room number. C. Check their ID band and ask their name. D. Ask a visitor. Answer, C. Proper identification includes verifying the ID band and asking the resident's name. When giving a bed bath, the CNA should A. Only clean visible dirt. B. Use the same washcloth for entire body. C. Wash from cleanest to dirtiest areas. D. Skip perineal care if the resident is unconscious. Answer, C. Washing from cleanest to dirtiest reduces the spread of microorganisms. Which of the following is a basic need according to Maslow's hierarchy? A. Respect. B. Love. C. Food. D. Education. Answer, C. Basic physiological needs such as food, water, and shelter must be met first. A resident refuses to take a bath. What should the CNA do? A. Force the resident to bathe. B. Tell them it's mandatory. C. Respect the resident's right and inform the nurse. D. Document it and ignore. Answer: C. Residents have the right to refuse care. Notify the nurse and document the refusal. Which position is best for eating in bed? A. Supine. B. Prone. C. Fowlers. D. Sims. Answer: C. Fowler's position, head of bed elevated 45 to 60 degrees, helps prevent aspiration while eating. What is the purpose of a gait belt? A. To lift the resident. B. To restrain the resident. C. To assist with safe ambulation. D. To support the CNA's back. Answer: C. A gait belt provides support and stability when assisting residents with walking. Which of the following is considered a sign of elder abuse? A. Consistent mood. B. Clean appearance. C. Unexplained bruises. D. Alertness. Answer: C. Unexplained bruises, burns, or injuries may be signs of physical abuse. What should a CNA do if they notice a resident has pressure sores forming? A. Apply lotion and ignore it. B. Report it to the nurse immediately. C. Increase fluids. D. Reposition them weekly. Answer: B. Skin breakdown must be reported to the nurse immediately to prevent further damage. When feeding a resident with dysphagia, the CNA should: A. Feed quickly. B. Offer liquids with a straw. C. Feed while they're lying down. D. Sit them upright and offer thickened liquids. Answer: D. Residents with dysphagia need to be upright and may require thickened fluids to prevent aspiration. A resident is angry and yells at the CNA. The appropriate response is: A. Yell back. B. Walk away. C. Stay calm and listen. D. Call security. Answer: C. Maintaining calm and listening to the resident helps de-escalate the situation. Which of the following is a sign of hypoglycemia? A. Flushed skin. B. Cold, clammy skin. C. High blood pressure. D. Slow pulse. Answer: B. Hypoglycemia symptoms include cold, clammy skin, shakiness, and confusion. What should the CNA do before leaving a resident's room? A. Close the windows. B. Leave the call bell out of reach. C. Ensure safety measures are in place and call bell is within reach. D. Leave side rails down for comfort. Answer: C. Ensuring safety and access to the call bell is part of ending care responsibly. When collecting a routine urine sample, the CNA should: A. Use a sterile container. B. Collect urine directly from the catheter. C. Label the container after leaving the room. D. Wear gloves and label in front of the resident. Answer: D. Gloves should be worn and the container labeled in front of the patient for accuracy. A resident's family member asks about their diagnosis. The CNA should: A. Share what they know. B. Refer them to the nurse. C. Give a general answer. D. Ask the resident to explain. Answer: B. Medical information should only be shared by the nurse or physician. The best method for communicating with a resident who is hearing impaired is: A. Talking loudly. B. Writing everything down. C. Facing the resident and speaking clearly. D. Using hand gestures only. Answer: C. Facing the resident and speaking clearly allows for lip reading and better understanding. What should the CNA do if they find a broken piece of equipment? A. Use it carefully. B. Ignore it. C. Report it and tag it out of service. D. Fix it themselves. Answer: C. Faulty equipment should be reported and removed from use to prevent injury. A partial bed bath includes washing A. The whole body. B. Only the arms and legs. C. Face, hands, underarms, back, and perineal area. D. The feet only. Answer: C. A partial bed bath includes the areas that need daily hygiene attention. The term perineal care refers to cleaning A. Feet. B. Face. C. Genital and anal areas. D. Abdomen. Answer: C. Perineal care involves cleaning the genital and rectal areas to prevent infection. A resident is scheduled for a morning surgery and requests water. The CNA should A. Give a full glass. B. Give half a glass. C. Check if they are NPO. D. Allow them to drink slowly. Answer: C. Check for NPO, nothing by mouth, status before giving anything to eat or drink. When caring for a resident with Alzheimer's disease, the CNA should A. Yell when they forget something. B. Use clear and simple instructions. C. Leave them alone. D. Remind them they're wrong. Answer: B. Clear, simple, calm communication is essential for effective Alzheimer's care. Which vital sign is most important to check before a resident receives a warm bath? A. Weight. B. Temperature. C. Pulse. D. Blood pressure. Answer: D. Blood pressure should be checked before a warm bath because bathing can cause significant changes in blood pressure, especially in older adults, potentially leading to drops or fluctuations that may be risky. The purpose of using standard precautions is to A. Protect staff from patient complaints. B. Limit patient contact. C. Prevent transmission of infection. D. Eliminate need for gloves. Answer: C. Standard precautions help prevent the spread of infections from patient to caregiver and vice versa.